Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim Mustafa. This is Health is Wealth on Jamia TV. Today we're talking about a very serious topic. What is the topic? You think about a disability that is reversible. Today we highlight it in our show tonight. Joining me to help us understand exactly this type of reversible disability is Dr. Nancy Ndirangu. But now, what is this reversible disability? We are talking about Clubfoot. Daktari, karibu sana.
Asante.
This is Jamia TV. We want to educate these people to ambie exactly what happens. Ni nini a Clubfoot? Unajua tulianzia reversible. Why is it reversible? But before we do that, I didn't talk much about you. Daktari is a physiotherapist working in Nairobi County, right?
Yes.
So karibu sana. You as a physio, I know you encounter a lot of reversible and irreversible disabilities.
Yes.
So to begin with, I'll kindly request you to introduce yourself. You tell us what you do as a physio, then we move from there.
Yes, my name is Nancy Ndirangu. Yes. I'm a physiotherapist at Nairobi County. Currently stationed at Pumwani Maternity Hospital and Kamkunji Sub-County. So most of the time you'll find me in Isli and in the whole of Nairobi County when called upon.
Okay.
Clubfoot is a congenital idiopathic disability or congenital idiopathic reversible disability. When I talk about idiopathic, its cause is not known. When I talk about congenital, I'm talking about most children or all children are born with it. You notice clubfoot at birth. When a child is born, you realize the feet are not looking forward like the others. They are looking inward. And at times I like demonstrating. They look like this. So clubfoot is something that surprises both the medical team and the patient. Because when you're delivering a baby, often you want to deliver a baby with no disability. But fortunately with clubfoot, we have several clinics that have been developed in Kenya and it is reversible. We are able to manage it using 3 steps. That is casting. Casting is putting POP or plaster of Paris. Then tenotomy. Tenotomy is a minimal, is a small surgical procedure that is done just in the clinic. You don't have to go to theater. And then bracing, which is we put the feet in an anti-deformity position. If the feet were born this way, then we put them in this position, the opposite position, so that we maintain them in the anti-deformity position for them to come back to the normal position. Yes. So
you've highlighted to us exactly what a clubfoot means. The main causes, you said, it is not known. Now, before we get into knowing if someone is having clubfoot, I want to know now the facilities in Nairobi that handle clubfoot. Then later we talk about this clubfoot, the root cause, because there are some of the root causes that can be traced, right? So help us understand now the facilities first before we get deep into it.
Clubfoot is managed often in the public facilities using the Ponseti method. And it is in Pumwani Maternity Hospital. We have a Clubfoot clinic on Tuesdays. Mama Lucy Kibaki Hospital. Mama Margaret Kenyatta Hospital. Kenyatta National Hospital. Kiambu, I count it as Nairobi. And Kiambu Hospital. But the people that support us do Clubfoot is an NGO called HopeWorks. Thanks to them, because they're the ones who trained us in the new method, that is the Ponseti method. And then they established a system of supporting clubfoot management in Kenya.
Yeah.
That happened more than 20 years ago.
Yeah.
And that's why you rarely or no longer see people walking with their feet looking inward today, because HopeWorks has done a lot of awareness, has done a lot of training, has done a lot of monitoring of how the treatment is going on. So they support all those clinics. Even APDK Westlands, they support it. And we have had a great success because we have more than 2,000 children born with clubfoot in Kenya every year. And they're able to support us manage those children. And they're able to work also with AIC Cure. Because Kijabe Hospital is another hospital that supports us in management of clubfoot, especially when it reaches a point where we have to go for surgical intervention, which they do. Also, is not a really major operation, but it is more technical than the simple, common correction method.
Wow, wow, wow. That is a very good initiative. And indeed, for 20 years, you must be having a very good experience in this country. Now, I'm so concerned about how common, because you said most of the children are born with it. How common is it in the country and globally?
Globally, the research still says 1 to 1,000 children are born with clubfoot. But in Kenya, at least 2,000 children are born with clubfoot. And those are the ones that we have captured in our data, the ones that we have met. Otherwise, I know there are much more children that have not been reached and have not been corrected, because we need more support from the government. We need more support from the other non-governmental organizations, so that we can make sure every person that is born with clubfoot gets full correction, because the treatment of clubfoot is also a long journey. We have to put plaster of Paris or casting. Every week we put and remove. We put and remove. So we correct gradually, which is also, we used to call it serial casting. But we correct it such that you come the first week with the baby, we correct to where we can, the first week, the second week, the third week. By the 4th to the 6th week, we have fully corrected the foot. But now we need to maintain it, and we need to release the tendon Achilles, which is a tendon behind the ankle that makes it very tight. So we have to do that minimal surgical procedure to make sure the foot is as flexible as possible before we finish the casting and we put the child on a maintenance phase of the abduction braces.
Oh, nice. A lot of casting is done. You said bracing, tenotomy. Yes, tenotomy is a form of surgery, right?
It's a minimal.
It's a minimal surgery.
Surgical procedure. We call it a surgical procedure because we have to get to the tendon, Achilles tendon. That's why we are calling it a tenotomy. And cut it using just a simple surgical blade. We don't even suture. It's just cut, then we cast. It's left open. It's just like a knife cut. You see the way you cut your toe or your fingers when you are cooking. It is a simple cut.
Very simple cut.
But it has to be called a surgical procedure because it has to be done under very sterile and medical procedure.
That is tenotomy.
Tenotomy,
yes. Well, you help us understand about bracing. Maybe, what about bracing?
Bracing is the abduction brace. It is a shoe that has a metal in between. So the feet are in the shoe. These are the shoes. And between these and this, or between this and this, is a metal that helps the feet be maintained in that position. And this is, I say it's the hardest and the longest process and journey, because it takes 5 years
to correct
in an abduction brace to maintain. We have fully corrected, using the casting and the tenotomy.
Okay.
Now the maintenance phase is the hardest.
Okay.
And the reason why it is hard, it is because it is long. And sometimes the baby feels like they are put in a position that is not suitable for them, although they get used to it, because they don't know any other thing. They were born with clubfoot, they were casted, and they were put braces, so they don't know. It is you who knows that an abduction brace is not supposed to be there.
Yes.
But the child doesn't know. The child came into this life, was casted, was done tenotomy, was put in an abduction brace. So it is you who knows. It is you who thinks it is uncomfortable. But the baby is already used to that position because that is their normal position until 5 years.
Okay.
Yes.
Can it be present during birth? Maybe this now clubfoot. Can it be present during birth, and maybe later in life after birth? Can it develop?
Clubfoot is congenital.
Okay, congenital. All right.
So we see it at birth.
Okay.
And it's supposed to be corrected from birth, from the time a baby is born.
Okay.
That's the best time to start casting.
Okay.
Because at that time, the muscles are still very flexible, and the joints and the bones are not fully formed, and the tendons and ligaments are not as hard. Like later in life, as they continue to mature, they become harder.
Yeah.
The tissues become more firm.
Yes.
So it is easiest to correct the first 2 months of life.
Okay.
Then we continue with the abduction braces, which is the maintenance stage for the next 5 years of life. That means the first 3 months to 4 months, we put the abduction brace day and night.
Okay.
But at least at that time, the baby is still very young, doesn't have a lot of movement. And that is why we also encourage we start early, because also it's easier for the parent and for us to manage when the baby is still in that developmental stage where they don't have to move a lot.
Okay.
Then from the 5th month of life, or rather the 6th, depending whether the cast went for 2 months or 1 month, we put after the 5 or 6 months, we put the abduction brace only at night.
Okay.
But now for the next 4 years, 4.5 years.
So
it's such a long journey.
It's a long journey indeed.
And remember, they have to come to the clinic the first 1.5 months or 2 months, as we cast every week. Then after the abduction brace, we still have to tell them to come to the clinic to confirm they're using it the right way, and also to confirm there is no recurrence.
Okay.
Yes.
So after 5 years, this child will be fully recovered?
Yes. After 5 years, unless we get recurrence, which is minimal, but we get. And that is why we insist on the parents following every step and everything that we have told them about that foot to prevent recurrence as much as possible. Because one thing I always tell my clients about clubfoot, clubfoot has a very high tendency of recurrence.
Okay.
So you must use the procedures and the abduction braces to the letter for 5 years. If not, the risk of recurrence is there.
Okay. You must use you must follow the procedure
to the letter.
To the letter.
Yes.
Now I want to understand, because the risk is there. And of course, now this is where we get ourselves into the risk factors of clubfoot, because of course there are some of the things that increase the chances of clubfoot. Can you highlight them for us?
One of the risks that increases clubfoot presentation is twin or multiple deliveries, where we get a lot of postural clubfoot. We also have conditions that predispose the child to clubfoot. One of it is spina bifida and hydrocephalus. Most of the children that are born with hydrocephalus and spina bifida, a good number of them will also present with clubfoot.
Okay.
So we also have a condition called arthrogryposis, or other orthopedic conditions can also predispose the child to clubfoot, especially postural clubfoot.
Okay.
Yeah. There are other factors that may predispose the child, but that is not confirmed by research.
Okay.
So we cannot just assume that maybe smoking, if I talk about smoking and drug abuse in pregnancy, it may or may not, and maybe it may, because most children that are born to mothers that abuse drug in pregnancy, you will find them with low calcium levels.
Okay.
So maybe the orthopedic nature of their bones and the position and the laziness, also drugs will also put you in a lazy state. So the baby will not have enough fetal kicks that they are supposed to have because of that being dragged by the mother. Maybe.
Okay.
But it is not confirmed by research.
Okay.
Yeah.
You talked about very serious terminologies, the terminologies that are not used for us so much. But now I want our viewers back at home to understand exactly what we are talking about and how it concerns them, because it is something that might happen to me or to any one of us any day, anytime. But now the question that I wanted to pose, you talked about some parents using drugs. But now the question I wanted to ask is there any kind of food that can cause clubfoot?
No.
No?
There is no type of food that causes clubfoot. And clubfoot can only be caused by maybe the DNA. Some is genetic.
Okay.
Like it is more common in boys than in girls.
Okay.
So I can tell you of one specific patient who gave birth to the firstborn boy, had clubfoot.
Okay.
Secondborn boy had clubfoot. Thirdborn was a girl, didn't have clubfoot.
Is it hereditary?
Yes. But the DNA is not as close as other conditions.
Okay.
You will find that maybe your great-great-grandmother had it.
Yes.
But it can be from the immediate mother or father if it appears in both families. So the gene dominates in both of them. So that rarely appears, but it can appear.
Okay.
That's why we call it idiopathic, because the cause is not well known. Even the genealogy at which DNA you get clubfoot is not well known.
Maybe kuna kitu ingine ambayo mtu akiwa pregnant maybe inaweza msababishia, kwa sababu you talked about some of the 4 factors that may lead a child to get clubfoot while the mother is pregnant. Is there any other factor yenye inaweza fanya mama akiwa pregnant mtoto anatoka akiwa na clubfoot?
Okay, ile jambo ambao naweza kuzungumza ni kuhusu sana sana spina bifida na hydrocephalus. Na ni vizuri mama kabla apate mimba aweze kutembelea daktari wake na apewe dawa sana sana folic acid ambao inasaidia the nervous system to develop the first 28 days of life. Kwa hivyo clubfoot ya hydrocephalus na spina bifida inaweza kupreventiwa at a certain level na inaweza kosiwa in pregnancy because of deficiency of vitamin B's components that are necessary for the very fast growth of the nervous system in the first few days of life.
Yes.
How
can a parent identify clubfoot? Kwa sababu nao tumeongelea kuhusu mtoto amezaliwa na mostly hii kitu inajulikana kama mtoto ashazaliwa. Mzazi atajuaje kwamba huyu mtoto wangu ako 2 weeks ama ako a month anakaa ni kama ako na clubfoot? How can they identify it?
I would say using ultrasound, especially the advanced ones, like the 3D yenye ukipiga unaona exactly mtoto wako vile anakaa. Sana sana that one, you can see the clubfoot in the ultrasound at 20 weeks of pregnancy. You can tell that my baby has clubfoot and you can start planning for the treatment in pregnancy. Actually, in Western countries, before a baby is born, they know they have clubfoot.
Okay.
Because they are able to do intrauterine management. Okay. The baby is able to be diagnosed with so many conditions when the mother is still pregnant. So that is something we need to go to in Kenya. We need to advance in intrauterine examinations so that we can be able to identify and also do investigations that establish some of the challenges that the baby may be born with. Yeah.
Sasa hawa watoto ambao wanazaliwa na clubfoot, wakiwa na clubfoot, is it painful for them?
It's not painful. Its presentation, just like most physical disabilities, are not as painful.
Okay.
And you had asked a question about how a mother would know.
Yes.
A mother knows by seeing. Even you, when you see, you will see these feet are not okay.
Yes.
So when the feet are not okay, you should be able to take them to a medical facility and more often to either an orthopedic surgeon or a rehab unit. A rehab unit has an occupational therapist, a physiotherapist, and an orthopedic technologist.
Yes.
The braces are actually made or fabricated by the orthopedic technologist. So when you come to us, we will be able to establish whether it is clubfoot or any other disability. Yeah. Because apart from clubfoot, we have many other disabilities that babies can be born with.
Yes.
And some of them can develop, as you asked, like bow legs, like knock knee. They can develop even as the baby grows.
Yes.
Yes.
That's very inspiring indeed, because for those parents who are having children with clubfoot, you have to be aware that there are very many facilities within the country that can help your child recover, because this is a reversible form of disability. Yes, your child may be disabled, but that doesn't mean he or she have to live that way. So we are with Dr. Nancy, and she is indeed helping us understand a lot of these things that we as parents, we as caregivers, we as those people staying home, guardians, we are not aware, we are not sure about exactly what happened. So daktari, asante sana, na naona show inabamba, lakini sasa maswali ni mengi, sijui nianzie wapi, kwa sababu after knowing that someone is sick, you diagnose them. You diagnose them. Then after you diagnose them, you treat them. Let's talk about those people ambao ni wakubwa kabisa. Mtu akiwa mkubwa hivi like kama 5 years, 6 years, then now unajua very many people live in interiors. Especially the marginalized communities and the marginalized areas where getting access to this service kidogo inakuwa shida. What should they do?
Anytime you realize there is clubfoot in your child or a neighbor's child,
yes,
visit us, and we will start with the same procedure. We will start with casting.
Yes.
Then, if possible, we do a tenotomy, because normally the tendon has really matured.
Yes.
Then we may put a brace or not, but most children after 5 years, we use surgical procedures to manage clubfoot.
Okay.
And we should demystify the religious perspective.
Yeah.
There is a very strong belief that if Allah has said or has created somebody that way, then it should be so.
Yeah.
Not everything that Allah has created should be followed as it is, because the same Allah has given people knowledge and skills on how to manage conditions.
Yes.
And that is why there is medicine.
Yeah.
So we need to come out and make sure we take our children to hospital. Let us not accept disability without management. We should be able to accept all disabilities with their management, not with ignorance. Because if we make everything spiritual, then life is going to be very difficult, and we'll find our children getting complications like osteoarthritis. Then others will not be able to play things like football. They'll not be able to run because they have a problem that could have been corrected.
Oh, yes.
Yes.
You've shared a very strong message to our parents and caregivers that we should not yes, spiritual life is very important. Believing in Allah is very important. But now, what if you're sick? Do you sleep and say, Allah will heal me? You have to go to the hospital. You cannot say, Allah will heal you when you haven't seen the doctor. Of course, if you are hungry, you have to look for food. Now, Daktari, there are always myths and misconceptions when it comes to, I know time is really not on our side. And I can see those people with adverts want to play their adverts. But now, there are always myths and misconceptions about anything. Have you encountered any of the myth and misconception about Clubfoot?
Yes, there have been very many myths, misconceptions, beliefs. Some think it's a curse. Yeah. Others think it's witchcraft. Mm-hmm. But we talk to our clients. In fact, we have clients that have been told by their husbands, in our family, we don't have disability.
Yeah.
So all those challenges we face with our parents, mm-hmm. the caregivers.
Yes.
But it's important for us to encourage, especially the male partners. Mm-hmm. The male partners are the most troublesome caregivers mm-hmm. when it comes to the journey of any disability.
Yes.
And we have to support our women.
Yes.
Because our women carry this pregnancy.
Yes.
Whether the baby has the Clubfoot or not, yes. they will have to breastfeed this baby. Yeah. Whether they have any other disability, they will still have to breastfeed. Yes. So I'm calling upon the male partners mm-hmm. to support our children yes. so that the healing journey can be easy. Yes. You can see it's a very long journey of 5 years.
It is indeed.
And I am requesting for more research to be done when it comes to Clubfoot management, because if we can reduce this journey of 5 years,
yes.
only research can help us do that.
Yes.
So that we can know what can we do to improve the treatment. What can we do to reduce the cause of disability? Because surprisingly, Clubfoot is the #1 cause of disabilities in the world.
Subhanallah.
And it is a reversible disability. Yeah.
Thank you so much. I think the message is home and clear. You've called upon parents and caregivers to come out. Let's not shy from visiting the doctor yani mtu anakuwa kwenye haka anasema like unajua kwetu hiyo ni uchawi, sijui hiyo ni hapana. Sometimes everything is created by Allah, and we have to believe that whatever that happens is destined to be on your side. So look for a medical attention. Daktari, asante sana. We will look for you because hatujaongea mambo mengi about Clubfoot. Tumeanza, that is just an introduction part of Clubfoot. So inshallah, we will look for time. We will create time. We engage you. We will also have Dr. Eric, right? He will also be joining us in the next episodes. We talk about this because the moment we keep silent, we will not solve the problems that are affecting us.
Yes.
And that is very important that you came. At least you opened our minds. And to our viewers, I know they've also been enlightened. Enlightened, right? So, ladies and gentlemen, I want to end it here because of time. But inshallah, when we find time, I'll still engage Dr. Nancy to help us. We said she is a physiotherapist. You might be having a lot of issues with regards to your bones, your hand, your leg. This is their job. This is exactly what they do. They correct some of the bones that have wanasema zimepitana kidogo. Zikipitana wao ndo wanajua kuzirudisha mahali pake. Kwa hivyo mtazamaji, mimi ni Kasi Mustafa. Mengi hapo ambayo tunatamani sana tuyaseme, lakini muda kabisa haupo, na nikiuliza swali jingine basi tutakuwa tunaingia zaidi ya muda ambao tumetengewa. Kwa hivyo mtazamaji, shukran sana kwa kutenga muda wako kutegea Jamia TV. Hii ni kikao cha afya yako, Health is Wealth. Until next time, same place, same time. Masalam.